Welcome to another episode of Health Talk Show, where we are going to explore the key to a healthier and happier life. I'm your host Polly Kormukar today, and with me we have some special guests from Bangkok Hospital, Thailand. So let me introduce to the guests today. First, we have Dr. Chaidej Sasamban, Orthopedic Surgery, Spine. Hello. Dr. Pongton Sirithi Chai,
Hello.
Orthopedic Trauma Surgery. Dr. Panuad Silawat Shananai, Orthopedic Surgeon, Hip and Knee Replacement. Welcome to Bangladesh and welcome to the show also. So we'd like to start Dr. Chaidej first. Hello doctor, how are you and how were you time in Bangladesh here? Is this your first time?
Yeah, this is my first time, but hopefully this is not my last time here.
We also hope it. Dr. Chaidej, as you were the expert in complex spine surgery, so you already know that Bangkok Hospital already earned a lot of trust from Bangladeshi people. So would you please tell us some updated facilities about your department or at your hospitals for Bangladeshi patients?
All right, sure. So we come from Bangkok International Hospital, which is the specialized hospital for orthopedics and neurology. So we have every kind of instrument that you need to do the operation. For me, I'm a spine surgeon. So actually, in our facility, we have some special instrument that we call O-arm navigation system.
O-arm, okay.
Yeah, that's some kind of CT scan intraoperative, and we can make the whole spine just into the 3D dimension system, and we can make it navigation. This is the benefit when we need to put some kind of instrument or some kind of metal inside the patient's spine, patient's body.
I heard it's a very complex one, I think.
That's right, and it's very complex and you need to focus when you do the operation. But by this instrument, the O-arm, the accuracy to put the metal inside your body is more than 99%. So I can say that it's very safe by using this instrument.
Is it kind of robotic or AI generated thing?
Not that kind. It's just like the navigation. Okay. And it's make the track to put the screw in. You just follow them.
Okay.
All right.
This is the most updated one.
Sure.
Or anything else?
Anything else I want to mention is about our more safety protocol.
Okay.
In every complex spine surgery, almost 100% right now, we use intraoperative neuromonitoring.
Okay.
This machine used to monitor the nerve function while we do the operation. Because when we do spinal surgery, we need to operate nearby the nerve, right? So it's going to be the good idea if we know before we get injured to the nerve.
To look over the detail.
That's right.
Okay.
So by using this machine, our major nerve injury rate is less than 1% in our facility.
Oh, that's good. That's good.
Yes.
So, Dr. Chaidej, I'm sure you have a lot of Bangladeshi patients from Bangladesh. So, what are the common types of symptoms at your department from Bangladeshi patients? Would you please tell us?
Yes, mostly the spine problems gonna be from cervical and for the lumbar spine. But almost of the Bangladesh patients that come to meet me, they already have at least one time surgery before.
Okay.
So we're gonna consider it as a revision surgery, which is a much more complex situation. I'm not sure why, but we see some patients that do the operation from Bangladesh or maybe from India, and we need to fix it. We need to do it again. So I think maybe it is a better idea if the patient have a chance to meet me or our team first.
What kind of complications they have faced after that first surgery? Then you need to do the revisional surgery. What kind of complications?
Yeah.
And the most type, what kind of?
Actually, there's a few kinds of problems that usually is seen. Firstly is the broken of the implant, like the metal they put inside, the screw, the rods get broke.
Okay.
The second problem is a nerve injury.
Oh, that's
Yeah.
That's
And the third one is like they're not treated properly and make the pain or the symptom of the patient persist after surgery, not getting better, something like that, which totally we call it a fail back surgery.
Oh, it's a
That's
very difficult situation for you
super
guys also.
difficult. Yeah.
So, please give us some advice for our audience. If you give what you want to say to our audience, any suggestions or any advice.
Okay, sure. For Bangladesh patient, I'm very glad to tell you guys that right now you can contact to our hospital, you can contact to our doctor directly by an email for our info team. And I want to make sure that every email that you send to us, we read it, all right? And also we have our own staff that is a Bangladesh staff or Bangladesh doctor who take care of you, so you're gonna feel like home when you talk to our staff.
So, Dr. Chaidej, thank you so much. I would like to go Dr. Pongton. Hello, Pongton. Welcome to Bangladesh. How are you?
Okay, thank you. I'm fine. I'm okay. Okay, this is my first time in Dhaka also.
Oh, so it's glad to see you here. So hopefully this is not your last time, like
be.
Dr. Chaidej.
Should be. I hope that.
So, Dr. Pongton, as you are the specialist in orthopedic trauma surgery, so as far as I know, trauma surgery is a vast area. So, would you please tell us some kind of types of trauma surgery you have done or you do?
Okay. In fact, the trauma surgery is mean we deal of all the fracture treatment except spine fracture. Spine fracture is a responsibility of the Dr. Shaides. So we do from the clavicle, shoulder, and to the ankle joint, and yeah, we manage all the fracture from the simple fracture to the complex fracture, such as the pivot and acetabulum fracture, fail fixation, complex fracture, or revision surgery, something like that. And yeah, we also have the full facility to help our surgery. Especially, we have the hybrid operating room equipped with the robotic C-arm. This kind is look like an O-arm in the spine surgery, but for the robotic C-arm used for the orthopedic trauma surgery, it can produce the CT scan intraoperatively. So with the CT scan, we can see more detail of the bone. That ensure the operation that we do the good reduction, good fixation for the patient. That's why we install this machine, and we aim to zero complication for the fixation to our patient.
Okay, okay. So, doctor, as so many Bangladeshi audience are watching TV right now, so could you please tell them what types of common symptoms you have seen among Bangladeshi patients?
The most common of the Bangladeshi patient that I have seen before, most of them consult to me and our team with the complex fractures, and some of them have need to revision. I think it is the same problem with the spine in the spine field. Some of them have the prior operation before and fail fixation or not correct the operation in the prior operation. So that means some of them need to reoperate. And yes, the operation is more difficult.
Yes. Yes. So, what do you advise for them, like for revisional surgery, they should go to you before or something like that? What's your?
Okay, I have to say, it depends on the fracture. In the simple fracture, yes, I think every orthopedist can do very well. But in the complex fracture, especially for the pivot and acetabulum fracture, this is the most complex surgery in the field of orthopedic trauma. So this fracture needs super specialists and the team to operate, and sometimes most of them can achieve the good result only one operation. Next operation, second or third operation cannot do and achieve the 100% result anymore. So depend. But if they have the complex fracture, pelvic floor fracture, they can contact to us.
Okay, so audience must hear that you should contact to the Bangkok Hospital doctor when it comes to orthopedic section, so they would help you at their best. So now I'd like to come to Dr. Punawat. Hello, Dr. Punawat. Welcome to Bangladesh and welcome to our show also. How are you?
Oh, thank you, and it's thank you for warm welcome. And I'm delighted to be here, and I am very excited to share the detail
We are
of
also.
our hospital.
Thank you so much for coming here. Dr. Punawat, you were the orthopedic surgeon, hip and knee replacement department. So could you please share to our audience about some updated facilities at your department when it knee and hip replacement surgery?
Okay, absolutely. When patients come to our hospital, we offer the state-of-art of the treatment to the patient. For the hip replacement surgery, we use the direct anterior approach, which is a novel technique, and it's a game changer right now, because the new technique, we didn't cut the muscle, we just separate the muscle.
Okay.
And we come to inside to the bone and perform the hip replacement. So it means that the patient can recover well, fast recovery, and we can check the leg length of the patient. We can ensure that the leg length is equal after surgery. And
So it's very good, I guess, because it takes a lot of time, most of the surgery, after surgery, to keep the patients healthy. So it's good, I guess. And now I'd like to ask you about how many days they need to stay in Bangkok after their surgery.
Okay, typically around patients have to admit after surgery around 4 nights, and then around 2 weeks. I think that is the proper time, and ensure that everything okay. We can remove the pad dressing of the wound, good rehabilitation, so the patient can fly back to their country. Yeah.
It's really fast. It's really fast. So now I'd like to ask you, since nowadays more people are more into sports like football, cricket, and sports injury are one of the issue from them. So what kind of patients you have got from sports injury at your department, like hip or knee replacement?
Actually, the sport injury in the hip and knee area is responsibility by the sport medicine, or we call BASEM, which is accredited by the FIFA Center. Okay, and if the patient with come to me with a problem about the hip in the elderly patient, okay, that is our responsibility. Okay, so the hip replacement is the option is the responsibility of our department.
Okay, thank you so much. Would you like to add something about this case? Like, what would you do at your department when it come to the patients about sports injury?
Sure. I think we have a lot of patients who have sport injury which present with a disc herniation. Have you ever heard about it?
I didn't.
Yeah, it's just like the jelly between your spinal bone. All right. When you get injured, like you get hit on your back, or you falling down and your butt hit the floor, you can have disc herniation, and it means that it can compress your nerve on your lumbar spine, which gonna cause a lot of pain run along your legs. Maybe you can have numbness, tingling, or even weakness. So yes, in that kind of situation, maybe you need urgency surgery. So if for your question, I'm gonna say yes, we see it, a lot of patients get injured on the back.
Okay, Dr. Pungdu, you would like to add something about sports injury?
Yes, sport injury is some kind of low energy trauma. So in some situation can produce the fracture also, such as the bicycle patient and fell down, low energy trauma, but fracture of around the shoulder and the clavicle. And the most common is ankle injury from play basketball, football player running or something like that. And this is the most problem, I think, because of the ankle fracture. Sometimes the patient think it's just only the sleeping, and the injured minor pain, but the pain sometimes go long, more than a month or 2 months. That means it's some occult injury into the ligament of the ankle. So you have the injury to the ankle, to the joint. I think that should be visit the orthopedist to check in the early stage, few days after the injury, to prevent the occult injury and prevent the pain for a long time.
Okay. So Dr. Punat, what's your advice to the audience? Could you please share?
Okay, for my advice, I think that it's important to maintain the healthy of the knee joint and sport activity for keep the muscle around the knee joint is more strength. But for my recommendation, if you have any problem about the knee joint or hip joint in the early phase, you may need to see the healthcare provider nearby you. But if it cannot cure the problem, the next step may be the surgery. Please trust in the advanced medicine nowadays. It's very safety and effectiveness. Okay.
Okay, thank you so much. We're almost at the end of our show. Thank you so much for presenting here and giving your valuable advice and suggestion to our audience. So audience, I hope you will be benefited from this episode, and till the next episode, stay happy, stay healthy.